Greetings and welcome everyone to this first anniversary gathering of leaders in the movement to scale up WASH and healthcare facilities. I'm Hank Habich with Global Water 2020, and with the Global Health Council, I'm pleased to co-host this important event. We had nearly 400 people sign up to join us here today, and we will have, you'll be joined by hundreds of people from around the world. You're here for three reasons. I don't have to remind you why you're here. You are the believers and the leaders. You understand the unacceptable human cost when a healthcare facility does not have WASH. You know that WASH helps achieve multiple healthcare objectives in every community in the world. And finally, you know that scaling up WASH and healthcare facilities is eminently achievable. So today, we're here to celebrate the movement from awareness to action, and the fact that since our event at the Pan American Health Organization just last year, nearly 100 organizations have committed to scaling up WASH and healthcare facilities around the world. So let me start by saying thanks to all of you. Success in life is about commitment and about following through on commitment. And that's what we're here to celebrate today. Also today, we're not just here to celebrate, we're here to build momentum toward institutionalizing WASH and healthcare facilities. We want to see the day when WASH and healthcare facilities and in budgets and in healthcare plans is second nature. It's not something that has to be argued for, that it's just second nature. So this morning we have a jam-packed 2 hours, so get ready for a lot of great discussion. We have a 1 hour plenary session, which we're beginning, and then we'll have a session, breakout session with which you'll all be able to participate. We have quite a few great leaders who will be speaking with us, both in the first hour, and then you're the leaders who will be speaking in the second hour. Just a few logistical points. First, in the plenary, as I mentioned earlier, please turn off your audio and turn off your video for the plenary session. But there is a chat function, and you're welcome to submit ideas and questions in the chat function, and we will definitely keep track of that. Second, when we have the breakout sessions, you will be transported to a breakout section that you were assigned based upon your preferences that you expressed. That's the time we want to hear from you. You'll be both able to talk and to chat in that breakout session. Finally, this event is recorded because we want to share it widely, but no statements that you make individually as participants, as opposed to our speakers, will be attributed to you. So let's get started. It's my pleasure now to introduce our co-host and a good friend and a leader in global health in her own right, the President and Executive Director of the Global Health Council, Lois Pace. Lois?
Well, thank you, Hank, and happy Wednesday, everyone. I assume it's still Wednesday wherever you're tuning in from around the world. I want to first thank our co-hosts and thank Hank for kicking things off for us today. And as you said, this is really first and foremost about a celebration of all of the work that you all and we all have done this past year towards advancing WASH in healthcare facilities. And wow, what a difference a year makes. I don't think that any of us believed that we would be in this moment, in quite this moment at this point last year, and yet here we are. And so I feel a few things given everything that we've endured the past few months. First of all, I have so much faith and confidence in the work that you all are doing. And honestly, I think that today can offer each of us a really important dose of energy and hope for what can be done, especially considering that finally WASH is squarely in the health agenda, and especially coming from an organization that really works closely with the broader health community. I know it's been a challenge sometimes to help everyone across various sectors or priorities truly understand the value of water and sanitation with regards to health. I don't think anyone questions that now in the middle of a pandemic when this issue is so front and center and critically important. And yet, as Hank said, I think we want to leverage this moment and this time to build on momentum and to help people truly incorporate these recommendations and our hope for the future when it comes to true integration of health programs and priorities. So I think that's all I wanted to say. To kick things off, as Hank mentioned, we'll be hearing from a number of people throughout the first part of our program. I think it's my pleasure at this point to kick things off with a speaker who is going to give us an update on his commitment from last year. We're really excited to have this young professional from Malawi join us with his remarks to get us started. Thanks very much.
Hi, access to potable water is achievable in all healthcare facilities in the world, especially in the rural areas. Today, I'm happy to report that for the past year, I've contributed much to a construction of a mechanized borehole water supply system for a healthcare facility. A 33 meters borehole was drilled, and water is pumped into 2 storage tanks of 10,000 liters capacity in total, and the healthcare facility is the primary beneficiary. The system has 5 taps connected to it, and a community and the school also benefit. Remember, water is life, and for a healthcare facility, it means life to unborn babies, expectant mothers, and patients. Moving forward, provision of clean tap water in rural-based healthcare facilities should be our main focus, as we intend to achieve universal coverage of wash services under the Sustainable Development Goal number 6, which is to ensure there is availability and sustainable management of water and sanitation for all. My name is Wogile Wea.
I want to thank Mr. Wea for his remarks this morning. It's really encouraging to see the work that he's been able to accomplish with World Vision Malawi in this past year. And we know that many of you who have made commitments can probably sort of speak to similar success stories. And we're looking forward to hearing a bit more about those, both in the first part of the program as well as in breakout sessions. But as we know, it takes all of us in this fight, and I think we're going to go from local to global to feature the remarks of the former Prime Minister of Australia, Kevin Rudd, who's also the chair of Sanitation and Water for All. So, Prime Minister, we look forward to hearing from you your approach to a whole of government strategy when it comes to WASH and healthcare facilities. Thanks very much.
Kevin Rudd here, former Prime Minister of Australia, currently President of the Asia Society Policy Institute in New York, but more importantly, Global Chair of Sanitation and Water for All, and have been so for the last several years. Bottom line is, in the midst of this COVID-19 crisis, it underlines again the absolute importance of effective water and sanitation services. You know the figures. 1.2 billion people around the world do not have access to wash at home. The coronavirus crisis has highlighted the crucial importance of delivering sanitation and water for all. Of course, on top of this, we have a double problem, and that is almost half the clinics and hospitals in the world do not have hand washing stations. And by some predictions, 2 billion people could seek care as a result of COVID-19 in a healthcare facility without basic water services, and 1.5 billion in a healthcare facility without sanitation. You know, and I know as professionals in the field, this is unsustainable. And given the deep uncertainties about the future trajectory of COVID-19, it falls to our sector to rise to the global occasion. And that means each and every one of us picking up the phone, taking out a pen, and lobbying directly and publicly local governments, state and provincial governments, and national governments to reprioritize water and sanitation at this time. Every government has COVID-19 right now near the top of its policy and political agenda. But they probably don't know that to be effective about that, they must elevate in parallel the water and sanitation agenda as well. So my call to action is, become locally politically active in getting your governments around the world to do the right thing by water and sanitation now.
Well, that's certainly a terrific call to action. Thanks very much, Mr. Prime Minister. And we very much appreciate your partnership, those of us in the non-governmental or NGO community. Of course, it takes governments working with non-governmental partners to truly get this done. And so I think those of us outside the public sector can heed this call to action and really use that energy and that inspiration to call for change. So next, we are going to hear from more governmental partners. In fact, we know that WHO and UNICEF have really largely been leading the way the past few years around Washington healthcare facilities. We appreciate their commitment and work, and we've been delighted to have that work gain so much traction, particularly in the past year with the WHO resolution and other developments. I know we'll hear from a representative from UNICEF later, but right now we're going to hear from our colleagues at WHO, starting with Dr. Maria Nerda, the Director of Public Health and Environmental and Social Determinants of Health at WHO.
We are in the middle of the COVID-19. Once again, one public health intervention that has no need to be justified. WASH in healthcare facilities. If there is one public health intervention that we need to implement, it's exactly that. The non-regrets intervention is WASH. And once again, don't call it a healthcare facility if there is no WASH.
That's an important point, Maria. Thank you. I know we have Dr. Maggie Montgomery also joining us, and who will be offering follow-on remarks to Dr. Nerda. If Maggie, you'd like to add anything or contribute additional comments to WHO's commitment to WASH in healthcare facilities, we'd love to hear them now.
Great, thank you, Lois. Yes, I just had 4 points I wanted to make. The first is last year was a monumental year, and we're really happy that the resolution passed. And it wasn't just that the resolution passed, it's that we now have 38 countries that are actively implementing the key aspects of this resolution around standards, around monitoring, around developing country strategies, but also around supporting health workers and making sure that they understand the importance of WASH, but also have the tools to be able to make sure it's maintained. We also launched the baseline numbers, which are helping us now track global progress. And I just want to remind you all, we do have 2030 set as a year for which we'll have universal access, and there'll be an update published actually next month on the WHO UNICEF Joint Monitoring Program site about where we are with actual access. The second point I just wanted to mention is tools and approaches. And we have the WASH Fit tool, which is an incremental improvement tool, and it's been adapted now to COVID. So I really appreciate the COVID now is encompassing everything we do. And I think on this issue in particular in healthcare facilities, it's quite positive. We're seeing that countries are finding COVID as an opportunity to highlight the fact there's lack of access, to do more assessments, and to make sure that COVID plans, including COVID funding, is going into these really fundamental services. What's next? Well, first of all, and in addition to advocating your government and your facilities, I encourage you to join the global conversation. There's a knowledge portal at in HCF.org, where there's a number of country tools, a number of country discussions that is an opportunity to really engage. The second thing is we are planning a pledging donor event with partners in the coming months, where it will be an opportunity to further elaborate what banks, what philanthropy, what governments are investing, and to make sure that those investments are going towards services that can be sustained and have an impact not only on health, but on the fundamental human right to water and sanitation. So thank you for the opportunity to speak, and I look forward to hearing from the rest of you.
Of course, many thanks for joining us, Dr. Montgomery. I think it's really helpful to get a sense of all of those resources, and hopefully we can make those widely available to the community either during or following the event, so that we can take you up on some of those really important and immediate next steps. Before I pass things back to Hank, I wanted to introduce another speaker this morning and an important perspective given 2020 is the year of the nurse and midwife. We're going to hear from Agnes Gichogo, who is a midwife and also a senior assistant director at Nyeri County Referral Hospital in Kenya. We're very fortunate to hear from her today. And so I will go ahead and hand things over to her before Hank comes back in. Please, Ms. Gichogo.
My name is Agnes, a nurse midwife working at Nyeri County Referral Hospital in Kenya. Our hospital, just like any other healthcare institution, requires huge amount of water for its daily operation. More so during this era of COVID-19, utilization of water in the hospital has greatly increased because of the role it plays in the prevention of the disease. Without water, services will not be cleaned, patients' linen will not be cleaned, patients' toilet and bathrooms will not be cleaned, patient staffs and other visitors will not practice hand hygiene. Surgeries and other medical procedures will not be performed or are delayed. As a result, there will be an increase in the spread of preventable infections, increase in antimicrobial resistance, patients will stay in the hospital longer, leading to low patient satisfaction. There will be increased hospital workload and other associated effects. As a nurse midwife, I feel confident when giving services in an environment with adequate and well-maintained water infrastructure. This promotes respectful and dignified care for our patients. Patients can shower, they can use and access flooded toilets and bathrooms. This adds to the quality of care from the patient's perspective. This also enhances job satisfaction amongst healthcare providers. In our county, most of the healthcare facilities have piped water from local water companies or rivers. However, access to this water for utilization has limitations. Some of the challenges that we experience in our hospital relating to water includes the high cost of water. Our hospital uses $30,000 on water bills on every quarter. A cost-benefit analysis of this expenditure would indicate that investing in rainwater harvesting infrastructure can help reduce this cost. There is inadequate hand washing stations in the hospital. Most of the wards have only one hand wash basin for use by the patients and staffs. Investing in establishing more water points for both inpatients and outpatients would enhance hand hygiene compliance amongst patients and staffs. There is inadequate patients' bathrooms and toilets for patients. The original ward infrastructure design included only one toilet per ward. This has been overwhelmed by the increasing number of patients admitted in the ward per given time. Each toilet and bathroom serves 20 to 30 patients. Investing in construction of more inpatient toilets would enhance patients' friendly environment. There are occasional water supply interruptions. They would result in serious compromise of hand hygiene, patients' personal hygiene, laundry and other housekeeping services, food preparation and hygiene. Investing in an emergency water supply plan like water storage tanks would improve this situation. In conclusion, investing in water facilities is an investment that has a return of investment.
Thank you, and thanks, Lois. These initial comments and in a most pronounced way, the comments of a frontline healthcare worker like Agnes Gichogo just reminds us why we're here. And the front lines, you know, the key in healthcare is the first contact is the healthcare worker. They're exposed. They're the ones who are delivering the care. And one of the main reasons we're here is to protect the healthcare workers, to make them more effective, and to make all healthcare more effective. As we noted, nearly 100 organizations of all sizes and all geographic locations have made commitments. And it's not just talk. These organizations have all followed through, and you'll see from our report on these commitments how virtually every organization has reported back the progress that they've made, and in many cases they've even exceeded the commitments that they've made. We don't have the time today, unfortunately, to recognize every organization, but we have a full report on that progress, and Lindsay Denny will share a link in the chat box, and then we will also send you a copy of the report that chronicles everything all these great organizations have been doing. We also have another book that we'll be sending you. It's an exciting book and a great read that highlights special stories of leadership in Washington healthcare. We're calling it the Trailblazer book. And to give you a little preview of that, oh, and by the way, you see on your screen, we'll just be, since we can't talk about it today, about every commitment, we want to show you the logos of the organizations that have made commitments. But let me turn it over to my colleague, Danielle Heiberg, to just give you a preview of the Trailblazer book. Danielle.
Thank you, Hank, and good morning, everyone. The community of practice has substantially raised awareness around the problem of WASH in healthcare facilities over the past few years. As Hank mentioned, last year, we generated nearly 100 commitments demonstrating the community's willingness to address these deficits. In 2020 and beyond, our goal is to continue to elevate the issue, but more importantly, to take significant steps towards the solution. In order to demonstrate progress and translate commitment into action, we are pleased to present the 2020 WASH in Healthcare Facilities Trailblazers booklet. This booklet includes 31 trailblazing organizations who are leading the way on WASH in healthcare facilities, shining a spotlight on the health leaders, the implementers, the researchers, the advocates, the innovators, and the COVID-19 responders. These diverse trailblazers demonstrate the variety of ways in which organizations can prioritize and institutionalize WASH in healthcare facilities within their strategies and agendas, how they partner with countries and other stakeholders, how they build and rehabilitate WASH services in hospitals and clinics, how they develop accountability and monitoring systems, and what lessons they've learned and what more we need to know. Again, we'll share this booklet with you following the event, and we hope you enjoy seeing the progress made to date. For those of you featured in the booklet, we hope you will share it widely with your partners. And for those of you who are new to WASH in healthcare facilities, we hope this booklet inspires you to take action. Thank you.
Thank you. Thanks, Danielle. For those of us who are toiling away every day on this gigantic task, this book is a great read. I like someone once used the phrase, these big jobs that seem to take a long time are like digging a hole in the ocean. But we're seeing that kind of progress now, and we see a way to get to scaling up WASH in healthcare facilities. The Trailblazer book will put fuel in your tank, and I commend it to you. And I just wanted to tell everybody that we have a lot of our committers on the call. We have others as well. That the window for commitments is still open. We haven't closed that window. And in fact, just in the last few days, we've gotten a couple of new commitments. There was one we just got in the last 2 days from the Partnership for Quality Medical Donations. This is a partnership that many of you are familiar with that delivers medical treatments and vaccines and drugs effectively to the places of greatest need. It's a partnership of major health-related corporations and implementing NGOs. So we welcome them and their commitment, and we welcome the participation of the corporate community. We want to highlight just a few more commitments for you today. We want to give you a flavor for the diversity of committing organizations, as we mentioned, both in size and in geographic scope. So first, we'll get an update from Nepal, and an organization there that's been leading the way and really creating some great models as Terre de Somme. And we'll be hearing from Prakash Bohara about what Terre de Somme is doing in Nepal.
Hi, Namaste. This is Prakash Bohara, Health and WASH Program Coordinator at TDS Nepal Delegation. Last year, we had made commitment that we would support WASH in healthcare facility in our priority countries, including Nepal. Today, I'm happy to tell you that we have translated this commitment into actions by providing support to local government to access and improve WASH services in 30 healthcare facilities combined with perinatal health intervention. I have some stories which could be interesting for you while working in this important but ignored area of intervention. It was a birthing center, but the apathy of the health management committee turned it into a cowshed. We sensitized them to the problem faced by the community, especially the mother and newborns, and offered some support as well, and which inspired them to establish a dignified birthing center. Trust me, the journey was not easy, and it took a year to convert it into a healthcare facility with basic services. The key message from TDS WASH intervention is that to bring sustainable changes, we shouldn't forget factors like engagement of health facility management committee, advocacy with the local authorities on the importance of this issue, and provision of operation and maintenance in healthcare facility. And most importantly, tools like Facet and WashFit are very useful for WASH in healthcare facility.
Thank you very much. This is some of the models that are being built in Nepal actually have application in many parts of the world. One of our colleagues at Global Water, Susan Barnett, visited these facilities and has some great ideas that came out of that. So thanks to the work that TDH is doing in Nepal. As I mentioned, our committers' work spans literally dozens of countries all over the world. And we wanted to highlight the work going on from a leading organization in the Middle East region. ANERA is an organization that we partner with because the importance of clean water in the Middle East region can't be overstated. So we're delighted to hear now from Rania El Hello Al Namara from ANERA.
Climate combined with conflict and poverty make water an extra precious resource in the places where ANERA works: Palestine, Lebanon, and Jordan. ANERA has been helping communities and families gain reliable access to water for 4 decades. One important community need and a strong focus of our work is water and sanitation at healthcare facilities. We believe that everyone should have the right to expect good healthcare, and this shouldn't be hindered by a lack of water, sanitation, and hygiene infrastructure. ANERA has scores of examples of WASH facilities we've built all over Gaza, but I will highlight 3 of the most recent ones here in Gaza. At the Quds Hospital, ANERA installed a reverse osmosis water filtration system that provides safe, clean water to meet all the needs of the hospital staff, patients, and medical systems, including these life-saving dialysis machines. At a nearby center working to improve child health and nutrition, ANERA installed a similar water system that provides pure, distilled water for the center's labs and drinking water for the community. The center no longer has to buy bottled water or ask families and patients to bring their own. And at a community clinic ANERA built to serve an area that didn't have easy access to healthcare, we ensure that every examination room has a clean running water, so doctors and nurses can provide top quality healthcare even in a modest clinic. If you would like to ensure that clean water and good healthcare go hand in hand in the Middle East, we at ANERA would like to work with you.
Thank you for that. It's been an honor to work with this organization and many others like it. And in addition to the organizations working on the ground in countries all over the world, I told you our partners are diverse, and so I want to highlight the importance of working with the larger organizations, the largest being the governments. And we've been working very productively with governments. In the United States, for example, we have had a great commitment and collaboration from leaders at USAID, CDC, State Department, and other agencies. And at USAID, they're modeling collaboration across the health sectors and the wash and water sectors. And these are areas that have all over the world been stovepiped. And one of the big challenges we have is to make sure those two sectors work closely together. So today it's fitting, we're honored to hear from the administrator of USAID, the Honorable John Barsa.
1 year ago, we came together and pledged to help strengthen water, sanitation, and hygiene, or WASH, in healthcare facilities. Our commitment was in recognition of an indisputable fact. A healthcare facility cannot provide safe and effective services in the absence of WASH. In far too many places, healthcare workers still labor without adequate WASH. An estimated 896 million people use healthcare facilities where there is no water service, and 1.5 billion people use facilities with no sanitation services. 4 in 10 healthcare facilities globally do not have soap and water or hand sanitizer at points of care. These gaps will not be easily overcome. Our success depends on the continued leadership and commitment from stakeholders across the healthcare and WASH communities. The COVID-19 pandemic has created a renewed sense of urgency to tackle these issues. Inaction will not only undermine our efforts to combat COVID-19, but erode global capacity to fight other and future infectious diseases. The U.S. government is committed to helping countries around the world establish and maintain basic WASH services in all households, schools, and healthcare facilities. The U.S. Agency for International Development, or USAID, is proud to lead that work. We know that strong healthcare systems and WASH access are essential to the resilience and self-reliance we seek to foster. We've redoubled our efforts at this critical time. Our COVID-19 strategy includes a specific focus on WASH in healthcare facilities. The pandemic may have created additional challenges, but it also provides us with a unique opportunity. Never has the need been more apparent. Never have the consequences of inaction been more clear. Last year we raised awareness and mobilized support. Now we need to turn words into action. I have the utmost confidence that this audience can do just that. USAID will work side by side with you along the way. By improving WASH in healthcare facilities and in all settings, together we can help build a safer, healthier world. Thank you.
Thank you, Mr. Administrator. You know, we're just beginning to see the benefits. There have been a lot of models of collaboration over the years, but we're really seeing, we're starting to reap the harvest of the benefits of collaboration across the health and water and WASH sectors on the one hand, and between the public and the private sectors on the other hand, focusing on the theaters of countries and regions and collaboration across those important organizations. And I'm delighted to introduce our next speaker. In the last couple of years, we've just been reminded that a pillar of WASH and resilient healthcare in the countries in greatest need are faith-based organizations, or as we call them, FBOs. In the poorest regions in the world, FBOs can sometimes represent 30 to 70% of all healthcare resources in those regions, and have been doing it in many cases for a century, and certainly for decades. So we've been honored to work with these organizations. I think fully 25 of the commitments that we received last year were from faith-based organizations, large and small, large like World Vision and Catholic Relief Services, and many small country-based organizations like Christian Health Associations and Muslim and other organizations of faith. The Accord WASH Alliance is a collection of organizations focused on water, and they've been delivering great results, and they're putting plans together to scale up to a great extent in countries around the world. So it's a particular honor today to hear from the Vatican. The Vatican has, the Pope himself, Pope Francis himself, has expressed concern and support for clean water. And we've worked closely with the Dicastery for Integral Human Development at the Vatican. And we're delighted that Cardinal Turkson, who's the prefect for the Dicastery for Integral Human Development at the Vatican, wanted to share remarks with us today. Cardinal Turkson.
Hello, we bring you very warm greetings from the Vatican Dicastery for Promoting Integral Human Development. And on this behalf, we greet all of you warmly and thank you heartily for the occasion to share these few words with you and to greet you at the beginning of your meeting. Because as a religious group with a mission to go to preach the gospel so that people may have life and have it abundantly, this life is not simply spiritual life, ethical life, but also life of well-being on the earth. And this life of well-being on earth is not simply political, it's not simply social, it's not simply economic, but also most importantly for several of us, it is also good living and health care. If with our health We have all the treasure that we need to live and live well. And to make this happen, we create an environment. And WASH helps create an environment for this healthy living that we all require. And therefore, when our groups go out to do mission, and recalling this, they do not only provide conditions for spiritual, ethical well-being, but also conditions like WASH, so clinics, hospitals, all the type of things which also enable us to live healthily. And so the program of WASH merges with our vision of creating hospitals and clinics to maintain a decent healthcare system for people. And that's why we congratulate you so warmly and are glad to associate with and be part of this program. So through WASH, cleansing of water, management of waste, and the observance of the conditions that keeps disease away from us and all forms of infection, let us work together to promote the human life, its thriving and prosperous forms. And for this, may God bless your meeting and have a very prosperous and successful meeting, all of you. Thank you.
Thank you, Cardinal Turkson. And let me turn it back to Lois.
Wow, it's very encouraging to hear all of those updates from various stakeholders. Thanks to each of you for offering those updates and giving us all a sense of your great progress. So now, we're gonna talk a little bit more about the work really happening at the regional and local levels. As we know, that's where the rubber hits the road, as they say, with a lot of these commitments, a lot of these aspirations. And actually over the past few years, we've seen the work in Washington healthcare facilities accelerate largely because of people on the front lines, on the ground. And so now we're going to hear from Bud Rock at Global Water 2020 to talk about the momentum at that level, followed by remarks from Dr. Chris Etienne, the director of the Pan American Health Organization. Bud?
Thanks so much, Lois. The sheer diversity of effort and the location of activities among so many organizations that we've heard from and others that we haven't heard from yet speaks to the global nature of Washington healthcare facilities and the challenge that we face. But in fact, we characterize the challenge as global. But as Lois has suggested, the true progress really occurs at regional, national, and local levels. So Global Water 2020, working with other organizations, in particular with the UN program offices and with countries themselves in specific geographical regions, has been putting together a series of regional meetings that will highlight the commitments that are being taken, that are being planned by governments, all of which are aimed at addressing Washington healthcare facilities challenges, and by extension, the barriers that need to be overcome and the additional support that is required. So we are currently planning a fall virtual meeting in Latin America, and that will be done jointly with the Pan American Health Organization. We are planning a winter Pan-African session with the support of the government of Kenya. And then we're also focusing on a spring session in Asia, the details of which need to be developed further. To highlight the importance of the regional action, we do have a brief statement from the director of the Pan American Health Organization, Dr. Carissa Etienne. Maybe we can turn to Dr. Etienne.
Dear partners and friends, today I wish to highlight the urgent need for accelerated action to address water, sanitation, and hygiene in healthcare facilities. Water, sanitation, and hygiene are essential elements for safe, quality healthcare. But today, as we face the most serious health emergency of the last 100 years, it is equally clear that ensuring access to safe water, adequate sanitation, and hygiene supplies for all healthcare facilities is an essential part of the response to COVID-19. Given the documented gaps in water, sanitation, and hygiene, which we refer to as WASH, due to the lack of those services in healthcare facilities worldwide, the World Health Assembly in 2019 passed a resolution calling for improvements in this area. Investments in WASH are more than essential. They are high-yielding investments as well. We know that every $1 spent on WASH saves an average of $7 in healthcare costs. This is one of the reasons why PAHO has been supporting WASH improvements in healthcare facilities since well before the current COVID-19 pandemic. We have supported countries in diagnosing the WASH situation, and we have made improvements in the availability and management of water supplies, part of the Safe, Smart, and Green Hospitals initiative. Now, in the midst of the COVID pandemic, we have redoubled our efforts to help member countries ensure that healthcare facilities have adequate and safe water supplies, fully operational sanitation systems, and hygienic conditions at all times. We are committed to continue to work with governments as well as public and private partners in the development and implementation of national roadmaps to close the gaps, and we welcome new partners as well. So please join us, if you have not already, to ensure that quality WASH services exist in all healthcare facilities. This is both an essential element of the COVID-19 response and a critical avenue for advancing towards universal health. Thank you very much.
Thank you very much, Dr. Etienne, and thanks as well to Bud for offering us that outlook of things to come at the regional level with meetings in Latin America, Sub-Saharan Africa, and Asia. That's very exciting. With more for looking ahead, I want to turn to our colleague from UNICEF. I mentioned their partnership with WHO earlier in the program, but now we are pleased to have remarks from Kellyanne Naylor, who's the Associate Director for WASH at UNICEF, to help us understand what their goals and objectives are in this space in the months to come. Kellyanne.
Hello, my name is Kellyanne Naylor, and I'm UNICEF's Associate Director for Water, Sanitation, and Hygiene based here in New York. I'm pleased to be addressing this virtual gathering on the first anniversary of the Commitments meeting, which was first held in Washington, D.C. last year. With sincere thanks to Global Water 2020 and the Global Health Council for organizing this monumental virtual event. The COVID-19 pandemic has brought an unprecedented challenge to all of our lives, and particularly to the WASH and health sectors. As a result, we have seen WASH and healthcare facilities rise to the top of the global agenda. The challenge is clear. Too many of our health systems and healthcare facilities are not equipped with essential WASH services. 1 out of 4 healthcare facilities do not have basic water. 2 in 5 lack hand hygiene at points of care, and likewise 2 out of 5 lack systems to segregate waste. As we work quickly to respond to COVID-19, we also have an opportunity to reimagine how we can collectively scale up WASH services and healthcare facilities. At UNICEF, we continue to integrate the practical steps to universal WASH access in healthcare facilities into our WASH and health programs, strengthening linkages with the response to COVID and climate resilience. We're also working with our regional and country teams to strengthen infection prevention and control efforts at the national and facility level as part of our key response to COVID-19. In the coming months, we are proud to announce that we will be launching a course on WASH and healthcare facilities in collaboration with Emory University, which will be open to all partners to strengthen their skills in program design and delivery. I would like to take this opportunity to thank all partners for the commitments you have made to improve WASH services and healthcare facilities and for the progress made so far. As we celebrate progresses and success, I would also urge you to prioritize this issue in your respective organization and make the required financial, technical, and other resource investments that are needed to meet this challenge. In closing, I would like to remind us that no single institution or organization can improve WASH services and healthcare facilities single-handedly. We must continue to work together, bringing our resources, our expertise, and our knowledge together to improve WASH services, combat the pandemic, and ensure that as we move forward, all babies are being born in healthcare facilities that have water and sanitation, and that our healthcare workers are safe from infections. Thank you very much.
Thank you, Kellyanne. Hank, back to you.
Great. Thanks, Lois. And thanks to Kellyanne Naylor. I hope that in this brief time you see from this rich group of speakers that we have the range of organizations that are committed and are delivering to WASH and healthcare facilities. It's exciting. And every single organization, big and small, and let me emphasize again, we're still welcoming new committing organizations, are key to the solution. The big organizations, some of those that we've heard from here today, like UNICEF, WHO, USAID, provide critical connective tissue to help create platforms for partnerships and for organizations to work effectively together. But I hope you find all of this encouraging. Now, we want to focus sharply on the path forward and some of the key success factors for really ramping up progress, moving from some great projects to really scaling up WASH and healthcare facilities. Let me ask if Dave Young is on with me. We're going to talk about one of the most important success factors that has come up in conversations we've had, every conversation we've had for the last 2 years, that if you want to institutionalize WASH and integrate it into healthcare, you have to mobilize adequate funding. So that's been a key priority of ours. We've spent a lot of time talking to large funding organizations, moving through the discussion process of just as we've all been doing, of understanding the critical value of WASH in healthcare, how it relates to and can be integrated into other funding and health priorities. So that awareness is there, and COVID, as terrible as it is, as it has at least helped funders focus on the importance of hygiene as an issue. And what we want to do is energize both short-term emergency responses to COVID, which are so critical for providing clean water, soap, and hygiene everywhere in the world, because COVID is leaving nobody behind and is not making choices, although it's certainly affecting minority communities much more. But to make those short-term responses effective, but to have them evolve into long-term foundation building for WASH and healthcare facilities. So it's a moment of opportunity, and that's why we wanted to devote a segment of this discussion here before we move to our breakout sessions on how we build a more sustainable funding base for WASH and healthcare facilities. So I'm joined here today by a good friend, Dave Young, who has, we don't have time to go through his whole resume, but what's critical points are that he was the Global Chief Operating Officer at World Vision for a number of years, overseeing all international program implementation. And now Dave leads the Societal Impact and Sustainability practice at the Boston Consulting Group. He's been a great advisor to us. So we only have time to hear from a few people today. We want to hear from a few experts to help define the finance issue. We've certainly lined up the right people to do that, but Dave, let me turn it over to you for some of your thoughts here.
Yes, thanks, Hank. Reflecting back, I mean, World Vision 1 learned the importance of the issue and put a priority on it. 2, they developed integrated community-based implementation strategies to bring that impact to scale. And 3, they made the WASH case to its funders. And folks like Dr. Greg Allgood led and championed those efforts field up. Now I work with corporations, institutional investors, development organizations, and folks like the World Economic Forum to promote smart strategies for human and economic development. And many of these organizations are seeking ways to invest and make a difference in WASH and WASH in healthcare, Hank.
Thanks, Dave. Dave and I will have a bit of a discussion of some practical steps forward and thinking big about steps forward in finance. But we have literally a dream team of speakers to hear from to help frame the finance issue for Washington Healthcare. We've learned over the last few years that there are certain key success factors for institutionalizing Washington healthcare facilities. The first and foremost is, as I mentioned, close collaboration between health funders and WASH funders in the finance space. A great example of this collaboration is being built at one of the largest global funders, the World Bank. And so right now we're delighted to hear from the senior economist in charge of these collaborative efforts at the World Bank, Claire Chase.
Greetings, my name is Claire Chase and I'm here today on behalf of the World Bank Water Practice to share with you progress that we've made over the past year or so on investing in Washington healthcare facilities and how we're looking at the issue of sustainability, particularly in light of the COVID pandemic. So following the call to action and the World Health Assembly resolution, we initiated a joint work program with our health practice to undertake analytical work and capacity building, which aims to increase both the quality as well as the quantity of investments in sustainable WASH services in healthcare settings. As part of the World Bank's COVID emergency response, the bank has committed $6 billion in fast-track financing for critical health sector needs. So under the health system strengthening component of those activities, of course, investing in WASH in healthcare facilities has been a critical activity. And in fact, of the 64 projects which have been approved by the board to date, 78% of those include investments in WASH in healthcare settings. So as a direct result of the pandemic, we've seen the number of projects more than double, which are investing in WASH in healthcare facilities. And there's really been unprecedented attention to this issue within the bank and particularly from leadership. So we recently held our virtual Water Week in the bank, and we had 275 staff attending our session on WASH for Resilient Health Systems. It was opened by Annette Dixon, who's the Vice President for Human Development, and Jennifer Sarah and Mohammed Pate, who are respectively the Global Directors for Water and Health, provided the closing remarks. So beyond the pandemic, how can we ensure sustainability? Well, over the next year, we are not only working to support these emergency operations, but really following these up with complementary investments, which can help to ensure that transition from the emergency stopgap measures to the long-term sustainability. And we also continue to work with our partners, including the WHO, UNICEF, and others, to identify synergies at the country level across our programs where together we can have greater impact. So thank you so much for the opportunity, and I really look forward to the outcomes of today's session.
Thanks very much, Claire. And one of my great hopes is that we see modeled everywhere in the world this actual, not just lip service, but actual collaboration between leaders in the health sector and leaders in the water, sanitation, and security sectors, like we're seeing now so well at the World Bank, and with the health group, the Water and Sanitation and Security Partnership, and the Global Financing Facility, among others. So a second major critical success factor is working in country to build cross-functional partnerships from the ground up. And one of the leading funding category of organizations that are doing this is philanthropy. And there, I can't think of any philanthropic organization that has been more of a pioneer and a visionary in the Washington healthcare space than the Conrad Hilton Foundation. So we're delighted to hear the perspective of Peter Lawhorn, who we heard from last year, who's the CEO of the Hilton Foundation. Peter.
Good morning. My name is Peter Lawhorn, and I'm the President and CEO of the Conrad and Hilton Foundation. If you're like me, you're probably already a believer in WASH and in SDG 6's promise of safe and affordable water for all. You probably live in a country where access to clean water is not an issue. You probably, when you go to a hospital or a clinic, expect safe and clean water, and you would be shocked not to find it, and you would make your shock clear in no uncertain terms. But you also know that this is not the case in many countries, that there are healthcare facilities with no clean water source. And we need to make that shock applicable to those cases as well. You know that these situations can lead to infection, to death, to patients not coming in for health services, especially in a world rocked by COVID. So let's raise our voices. Let's make sure that ministries of health and health funders know that this situation is not acceptable. And furthermore, in a world of complex problems, this is a simple one to fix. This is one whose costs are easily outweighed by its benefits, that is measurable, that is observable, and that is terribly doable. Again, let's raise our voices. Let's bring doctors and nurses and community health workers and patients into this discussion. Let's bring our allies from gender and education and other fields. This is a solvable problem, so let's get to it. Thank you very much.
Thank you, Peter. Hilton has been building very effective models focusing on district level partnerships that can be scaled up to country, that we believe can be scaled up to country level. And it's very exciting. So watch this space. Well, another key success factor in bringing a maximum diversity of funds to the table for Washington Healthcare is the need for innovation, both innovation in funding vehicles and innovation in the structure of solutions. And we're just scratching the surface of innovation, but we have a lot of commitments that focus on innovative ideas, including private sector organizations. But probably the best known and one of the greatest innovators in the water and sanitation space today is Gary White. Gary White is the co-founder with Matt Damon of water.org and Water Equity. They're mobilizing microfinance and other private capital to support households and businesses in the water and sanitation space. We're delighted to hear from Gary.
Hello, I'm Gary White, the co-founder and CEO of water.org and Water Equity. And of course, I want to talk to you today about the importance of safe water and hygiene and sanitation in healthcare facilities. We know, especially now in the time of COVID, there's nothing more important in the front lines than being able to wash your hands when you care for patients. And that is something that governments, I think, will become increasingly aware of and hopefully respond to. But as we look at that response and how do we work with government for these facilities and their support, how do we create the financing that's needed to install the proper infrastructure? And at water.org, that's what we've been focused on in terms of correcting those market failures so capital can flow. You know, we've now helped more than 30 million people get access to water through small loans and have mobilized $2.2 billion of market capital to do that. And so what we're looking at now is how can water.org and Water Equity focus on this going forward in partnership with governments. These facilities won't have the capital all up front to install the infrastructure. So what can be done to get them access to finance, to loans? And what about the businesses that will need to be there, either current businesses or new businesses and enterprises that can provide the infrastructure and build the infrastructure? Where are they going to get their capital to scale their businesses? And that's really what we're focused on at water.org and Water Equity, is getting that capital in the hands of the right people so we can meet needs like this. We recognize how important this will be, and we're committed to helping to bring that financing to bear so that when anyone in one of these low-income countries shows up at a healthcare facility to be treated, they know that the person caring for them has practiced proper hygiene, has washed their hands, and that they have the best chance of restoring their health because of those efforts. Thank you.
Thank you, Gary. That was inspiring. The Global WASH community has demonstrated success, all of you, project by project, but now needs to get well beyond one-off projects and come up with the big ideas for programs to achieve scale, to open the doors for private investment capital to multiply what philanthropy and donors can bring and expand implementing capacity. One of the best organizations that thinks about starting new big platforms is the World Economic Forum. And over the last 18 months, The WEF has catalyzed a new investment space for humanitarian and resilience investing, one that has promise for hosting appropriate large WASH and healthcare facility programs. And we're delighted to hear about a promising new initiative from Andre Kern, who leads humanitarian response and resilience initiatives at the WEF.
Thank you for the opportunity to share our views on the urgent need to accelerate public-private collaboration in sustainable WASH solutions. While we will continue to need humanitarian assistance as the COVID pandemic moves across the globe, we also need to broaden the capital base through new models of innovative finance that build long-term resilience. The World Economic Forum's Humanitarian and Resilience Investing Initiative, launched last year together with the ICRC, World Bank, Credit Suisse, and the Netherlands, seeks to catalyze impact-driven investments that benefits people affected by fragility while generating financial returns. We focus on bringing to the table new partners, expertise, and different types of capital around concrete projects that build self-reliance of the most vulnerable populations. I want to share 3 examples of innovative approaches and suggest 3 issues for this discussion. The ICRC is developing a water supply project in Goma, DRC, together with Sweden, the Netherlands, and Lobado DA, that will move from water trucking to building sustainable water infrastructure with a viable financing system. The IFRC and the Islamic Development Bank launched last year the One WASH Fund to support WASH interventions by blending outcomes-based financing with grant financing that shares risk between donors and investors. And in response to COVID, the Forum launched together with UNICEF, WHO, and the World Bank, the Mobilizing Hand Hygiene for All initiative to respond to urgent needs, rebuild markets, and reimagine sustainable WASH solutions. To unlock this financing, we need to identify and aggregate innovative financing projects to reach scale, to equip humanitarian and development actors to be able to work with investors, and we need philanthropic capital to fund early stage design and structuring of those innovative financing projects. No government or organization will be able to solve this challenge alone. We need multi-stakeholder partnerships and a robust pipeline of projects to accelerate innovative financing for WASH solutions. Thank you.
Thanks, Andre. And it's exciting to see the World Economic Forum in this picture. And thanks to David, we'll have a brief discussion here and hear more about it. But I just want to say this has truly been a dream team of speakers. And the good news is they're not just talking heads, they're all actively engaged, and they want to be actively engaged as being part of the solution. We also, I'll remind us, we also heard earlier from Maggie Montgomery from WHO talking about efforts there to convene large donor countries to discuss this issue as well. So all of these comments and all the things we've just been discussing, as well as many ideas that have come from you, and we hope will come from you, suggest a path forward on this financing issue and how we bring the resources to bear to scale up. Let me ask Dave what you see as sort of the key elements of this path forward.
Hank, I see 3 things. First, consider the priorities and allocations of existing budgets. Second, how do we create sort of far larger and more ambitious programs through collective action, partnering, and syndication? And then the third, ways to crowd in private capital and expand resources, impact, and implementation capacity. I think it's all 3 of those, Hank.
Absolutely. And on your first point, we know that WASH is foundational. Obviously, projects that integrate WASH into broader healthcare funding strategies and COVID-19 response programs are important and will work, and they need to happen as quickly as possible. And the short term builds the long-term foundation building.
Yeah, I agree, Hank. And further, those bilateral and multilateral organizations should review projects that they already have on the books and ask, if more funds were available, can this project be scaled further? Can there be a greater ambition, more reach, more depth of impact? What more could be added to achieve the Washington healthcare facility goals? What compelling vision can be presented to investors, and who should partner with them to achieve it?
Yep. And that, leads to your point number 2, where collective action, taking individual organizations that are already at work in a specific geography. I mean, we have committers, as I say, in dozens of countries. We take a specific geography, create a bigger vision, bigger scale, a bigger portfolio of projects that can can be syndicated at the project level and the funding level. The Hilton Foundation is doing this. Other organizations are starting to do this. How do we accelerate this, Dave?
Yeah, we know that impact capital is available, and the whole area of impact capital and sustainable finance is growing rapidly. And with the right case, it's open to investment. What we need here are large enough projects that can make scale impact and absorb the larger investments. That takes us generally further than the individual organizations offering up their own projects. It likely requires much broader project portfolios and a vision for districts and even countries that open it up to investment. And with those, we get to three, a large enough portfolio of projects that can be structured to use philanthropy and, official capital in ways that de-risk and open the door for multiples of that with private capital and institutional investments, for example, in infrastructures and blended finance outcome funds. That scale of funding would offer implementing organizations and incentivize local companies to participate and move from important, no question, important piecewise impacts, but to much broader system level impact and change. We are all extremely excited by the progress over the last year, but there's still an awful lot of talk of pilots, and we need to go beyond pilots. The very fact that WEF has catalyzed this new investment space for humanitarian and resilience investing, a platform with over $300 billion and over 1,000 projects listed on it, really shows there's demand for money that wants to be making a difference now. And WASH and healthcare facilities can be one of those.
Thanks. Dave, your perspective on this is so important, and this is exciting. This is the most exciting time I've seen since I've been working on this in terms of the awareness of finance, the possibility of mobilizing large pools of capital, not only the idea of maybe public multi-donor trust funds, which are certainly something that's possible and being discussed, as well as aggregating private capital through vehicles like the World Economic Forum. I think we've never had an opportunity like this to aggregate capital to actually scale up entire countries, and we have models like the Hilton models and other models of regional, community, and district-based initiatives that can be scaled up. So Dave, I really hope that you're going to be part of this. I think with a room of people like we have here, we can seize the moment and really make a difference here. So we encourage everybody, and we'll have some discussion about this going forward, to figure out new partnership and funding ideas and really make things happen. So Dave, thanks very much for everything you're doing and for joining us today.
Thank you, Hank, and more importantly, thank you for all those implementing and making a difference in the field and the lives of so many.
Absolutely. Well, so we're pretty much on time. We've had a lot of food for thought. We have a lot of smart people who've been very patiently listening to these great speakers and ready to share ideas.